Welcome to my channel, Trichotillomania. A mental health illness known as trichotillomania, or hair-pulling disorder, is characterized by an uncontrollable need to pull out one's hair, which causes hair loss and misery. We will look at the signs, causes, diagnosis, and remedies for trichotillomania in this post. Trichotillomania symptoms. The following signs and symptoms of trichotillomania are listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Repeated hair pulling. Trichotillomania patients experience an overwhelming impulse to pull out their hair, which causes hair loss. 2. Tension before pulling. Trichotillomaniacs may feel tense or uncomfortable before ripping out their hair. 3. Pleasure or relief after pulling. Trichotillomaniacs may feel pleasure or relief after pulling out their hair. 4. Severe distress or impairment. Trichotillomania significantly harms a person's ability to function in everyday life and creates severe suffering. 5. Repeated attempts to stop or reduce hair pulling. Trichotillomaniacs may make repeated attempts to cease or reduce hair pulling, but they often fail. Trichotillomania causes. Although the precise causes of trichotillomania are unknown, a combination of genetic, environmental, and psychological factors are thought to be responsible. According to certain studies, patients with trichotillomania may interpret information linked to sensations in their hair and skin differently. According to additional study, stressful childhood events like abuse or neglect may have an impact on the onset of trichotillomania. Trichotillomania diagnosis. Trichotillomania can be challenging to diagnose because sufferers may be reluctant to talk about their hair-pulling behavior or may not seek treatment. Trichotillomania can be identified by a mental health expert, such as a psychiatrist or psychologist, after carefully examining the patient's symptoms and medical background. Trichotillomania therapy, combining treatment and medication, is a common part of treating trichotillomania. For treating trichotillomania, cognitive behavioral therapy, CBT, is the most effective treatment option. The main goal of CBT is to assist people with trichotillomania in recognizing and altering unfavorable thinking patterns and behaviors connected to their hair-pulling behavior. Individuals learn to question their unfavorable ideas about hair pulling in CBT and to improve their positive coping mechanisms. The most popular treatment for treating trichotillomania is a class of drugs known as selective serotonin reuptake inhibitors, SSRIs. Anxiety and depressive symptoms linked to trichotillomania may be lessened with the aid of SSRI antidepressants. There are various approaches that may be beneficial for people with trichotillomania, in addition to counseling and medication. These may consist of habit reversal training. This kind of therapy teaches trichotillomania sufferers to recognize their hair-pulling behavior and to replace it with a more positive behavior. Acceptance and commitment therapy, ACT. This therapy aims to assist trichotillomaniacs in accepting their hair-pulling behavior and in learning more effective coping mechanisms. Mindfulness-based therapies. Mindfulness-based interventions, such meditation and yoga, can assist people with trichotillomania in improving their coping mechanisms and reducing the symptoms of their condition.